Arbor VA Eye Clinic is a really robust clinic. We have eye care services that range from more routine comprehensive medical eye exams all the way up to subspecialties for every type of subspecialty available in eye care. So we have a technician-based eye care screening program where the veteran can see a technician who can check the patient's prescription, and then they take a series of photographs of the inside of the patient's eye that a doctor later reviews to screen for any eye disease. We provide that both here in Ann Arbor and in some of our outpatient clinics. We provide regular comprehensive eye care, so eye exams where we're certainly meeting their visual needs as far as providing glasses, but we arguably more importantly check the patient's eye health. This patient population has a high level of medical diagnoses, things like diabetes or high blood pressure or other cardiovascular diseases, things that really can influence the patient's eye health and their vision long term. So we monitor for those types of things, intervene, when necessary. So there's a huge range of what we do here.
Lens 1 or lens 2?
A lot of eye care services in particular out in the community might not be as equipped to provide high-level medical eye care rather than just like routine quick eye exams or quick glasses checks. It's really so much more than that. The eye health and the patient, in the context of the patient's overall health, is so much more important. So here within the VA system, the continuity of care is amazing. We have access to every other clinic's notes. We know exactly what's going on with the veteran from a holistic standpoint. We can see all of the other medications that they're taking, all of the surgical interventions that they've had. We have access to understanding how medications might interact with the other ones. Patients sometimes have a really hard time remembering all of their medical problems or all of their medications, and when you're receiving care from multiple different systems, it's sometimes hard to make sure that we're all on the same page. But here, it's all centralized. We have access to VA records from everywhere in the United States, so it's just so integrated. One thing that I think is just unique to our facility is how robust our services are. We are actually only one of 2 VA hospitals in the state of Michigan that have ophthalmology here, which are our eye surgeons here in the Detroit VA. So Southeast Michigan is pretty lucky or special in that we have high-level subspecialty eye surgical care available right here on site. All of the other VAs in Michigan that have eye care have optometrists who can provide really high-level comprehensive medical eye care but cannot provide surgical intervention. So those veterans either have to come here from, say, Battle Creek or Saginaw, or need to be sent through the community care program. So we have just such a tremendous amount of variety in what we can provide right here, and I think that really does make our clinic a little extra special.